Morning. What do you do when you're faced with a difficult diagnosis or a case which was seemingly straightforward and pretty obvious, and it turns out after certain tests are performed, it wasn't so obvious? What's your next course of action? Whether you're a physician or a patient, this is important to all. I saw a few interesting cases this week, and one in particular was a young girl, and she complained of snapping. And this snapping was around the knee. So, in many situations, as we often say in medicine, if you hear hoof prints outside your window, it's probably a horse and not a zebra. However, sometimes the opposite is true. Snapping in the knee is frequently caused by a displaced or torn meniscus or cartilage disc in the knee. Certainly the most common reason. However, a reasonably good MRI did not show a meniscus tear. So a trial of physical therapy ensued. However, the patient's symptoms persisted, so another MRI was obtained. And that MRI was read as from the radiologist as being normal. However, the surgeon thought that a meniscus tear was present and recommended an arthroscopy or a scope to see whether or not there was, in fact, a torn piece of meniscus. Now, if the meniscus is going to snap inside the knee, it needs to be torn significantly, and a possible small tear is certainly not going to cause those symptoms. Well, an arthroscopy was performed and nothing was identified. So, what was the next course of action? Another course of physical therapy and another MRI, with the thought that they would look for a new meniscus tear. Yet, this unfortunate patient's complaints never changed. There was snapping in the knee. A simple question posed to her, where does the snapping occur, revealed what the actual problem was. There are instances where tendons around our knee can snap and pop because they can be caught on bony prominences. Portions of our bone can grow these little outcroppings and the tendons can snap over them. So it became obvious that her symptom was not because of the knee and was coming from somewhere below the knee, and a simple, quick procedure to remove that little outcropping alleviated the problem. Now, what do I do in my own practice when faced with a situation where is seemingly obvious is actually not so obvious? You have to go or head to the clouds. Not in the same manner as which we talk about online. I'm not talking software here. I'm talking heading up and taking a 20,000-foot view of the situation, or helicoptering. You need to just take a deep breath, relax, and start again. Engage the patient once again, start from the beginning, ask when the symptoms began, what causes them to occur, what precipitates it, what makes it better, have them point to the area that causes the problem, reevaluate, rethink, and reengage. And if at the end of this revisit you still don't have an answer, then of course the answer might simply be to refer. But sometimes those hoof prints that you hear are in fact a zebra. But even if they aren't, heading to the clouds for a 20,000 foot view will frequently clarify the situation and help you arrive at the correct diagnosis. Have a great day. Bye.